Health insurance can be confusing, especially in the United States. Just because you have health insurance does not mean that your health care is free. There will be fees you will have to pay. At Grinnell College, all students are required to have a U.S.-based health insurance policy.
During COVID-19 and the current academic year, students that are studying abroad during fall term 1 will not be required to have this U.S.-based policy. The health insurance waiver process still applies to all students.
Grinnell College's student health insurance does not mail out physical health insurance cards. All health insurance information, including your insurance card, can be accessed through United Healthcare Student Resources. Their URL is www.uhcsr.com/myaccount. You will need to create an account the first time you log in. Prescriptions have their own pricing structure. Be sure to check your insurance company for details. With the student insurance, prescriptions can range from $15 to $30. If your prescription is a generic drug, you will at most pay $15. Oftentimes, generic drugs are available for less. If that is the case, you will pay the lesser amount. For example, there are a large number of drugs that are just $4. In this case, you would only pay the $4 instead of $15. If you are prescribed a name-brand drug, you will at most pay $30. Here are some basic terms that are important to know. Copay. A copay is the amount you pay a doctor's office or provider at the time of services. You may have to pay a copay for each visit to your doctor. For the student insurance, you will need to pay $10 every time you go to the doctor, as long as the reason for the visit is covered. How do you know it is covered by the student health insurance? There is a large document that lists every service that is covered at www.gallagherstudent.com/Grinnell, or you can visit the provider website, United Healthcare Student Resources. You can also visit their app. Some examples. If you are sick and go to the doctor, that will be covered. However, if you go to the doctor to talk about acne, that visit would not be paid for by insurance. Medical procedures that are required are covered, but elective or cosmetic procedures are not. Physical therapy is covered, but not acupuncture. If you injure a healthy eye, health insurance would pay for that. But a routine eye exam or eyeglasses are not covered by the student health insurance. It is the same for teeth. If you injure a healthy tooth, insurance would pay for that work, but a regular tooth cleaning, cavity, or any wisdom teeth issue is not covered. Dental insurance is separate from student health insurance. Grinnell College does have an affordable dental plan available to students. This plan is not included with the cost of your student health insurance. There is a separate enrollment and fee. If you are interested in more information about getting the dental insurance, please talk with a Shaw nurse. Let's get back to some important terms. Deductible. The deductible is the amount you pay before your health insurer begins to pay. Some visits have this, and some do not. For example, if you're on the student insurance, the deductible doesn't apply for an in-network doctor's office visit. Instead, only that $10 copay I mentioned earlier applies. The deductible amount starts over each plan year. If you're on the student insurance, this is August 14th. This means that you have to pay the deductible each year before insurance will begin paying. The student insurance deductible for in-network providers is $150. For out-of-network providers, it is $350. Don't worry, we'll go over in-network versus out-of-network shortly. If you go to an in-network provider on the student insurance, you will have to pay a $150 deductible. So you've met that deductible, but then let's say you have to go to another provider who is out of network. You would then have to meet the $350 deductible for an out-of-network provider. In-network and out-of-network deductibles are separate. A deductible example. If you have a $1,000 procedure, you must pay the $150 deductible before insurance will begin to pay their portion of the remaining $850. That remaining portion falls under coinsurance, which we'll talk about next. But just know that you will have to pay that deductible before insurance will begin paying anything on their end. Coinsurance. Coinsurance is a certain percent that must be paid after the deductible. This payment is for covered services only. You may still have to pay a copay. Now, I just used a lot of words, so let's go over an example. The student insurance covers 90% of a bill after the $150 deductible. You will have to pay 10%. The 10% is the coinsurance. Looking at our $1,000 procedure, you will have to pay the $150 deductible, and that leaves $850. The coinsurance that you are responsible for paying is 10% of the $850, which is $85. The insurance company will then pay the other 90%, or $765. Remember in-network and out-of-network? They're back. In-network means that the insurance company has a deal with those providers. They will pay more on those bills and you will pay less. Out-of-network provider means that the insurance company does not have a contract with those providers, and insurance pays less and sometimes none. You will pay more. Student insurance will pay 90% of the bill for an in-network provider, and you will pay 10%. For out-of-network providers, student insurance covers 70% of the bill, and you pay 30%. You can find in-network providers on your insurance company's website. If you get referred to a doctor by a Shaw nurse, they will try to get you in with someone who is in-network. Don't worry, they know what all these terms mean and will do their best to give you an affordable option. In-network. Let's talk about emergency rooms, or ER visits. Emergency rooms should be used for emergencies or when no other care is available. If you are able to use another option for care, like visiting Shaw or going to a doctor's office, your care will end up costing much less. Here's why. ERs have their own copay. Remember, for a doctor's office visit, the copay was $10? Well, for those on the student insurance, the copay is $150 for each visit to the ER. This is in addition to the 10% coinsurance for any imaging or lab work that might be done while you're in the ER. It is important to know that if you are admitted to the hospital, this copay is waived, and instead your regular deductible and coinsurance would apply. Have you recently been to the doctor or another healthcare provider? Please check your school mailbox for bills. It can take a while for bills to be sent, as the doctor has to send information to the insurance company. The insurance company has to process it, then send it back to the doctor's office, and then the doctor's office finally gets around to sending you their bill. Unpaid bills are sent to collection agencies, and this does affect your credit score. So again, please make sure to check your school mailbox. If you have any questions about bills or insurance, you can always come to Shaw for help. We know that health insurance can get pretty complicated. To review. In general, if you go to the doctor and have a procedure done, so beyond a regular doctor's office visit, your bill will be the $10 copay plus the $150 deductible plus 10% of charges, usually. We hope you found this brief look at health insurance helpful. For more information, you can visit our website, www.grinnell.edu/Shaw, or visit our Facebook page, Grinnell College Shaw.